Hey guys, welcome to today's video. We're going to be talking about Tetralogy of Fallot. So first off, what is it? Tetralogy of Fallot is defined by a birth defect of the heart. It's a rare pediatric congenital heart condition, and it makes up approximately 10% of all cardiac malformations. So where does the name come from? Well, if we break it down, tetra means four, ology is the study of, and then Fallot is just the French physician who coined the term in 1888. Okay, so the four characteristics that make up this disorder include 1. Stenosis of the pulmonary valve, 2. Right ventricular hypertrophy, 3. Ventricular septal defect, and 4. Overriding aorta. So now we'll dive deeper into these four things and exactly what they mean and how they're all tied together. So the first thing is pulmonary valve stenosis, or PVS for short. So stenosis is just the narrowing of a structure, and pulmonary valve stenosis is the obstruction from the right ventricle to the pulmonary artery. So the second characteristic is right ventricular hypertrophy. So in general, hypertrophy is an enlargement of or thickening of cells. Right ventricular hypertrophy is a thickening of the heart wall. 3 is ventricular septal defect, or VSD. Ventricular septal defect is when there's a hole in the wall that separates the left and right ventricle. It allows mixture of oxygenated and deoxygenated blood. Okay, 4 is overriding aorta. So it includes a malalignment of ventricular septal defect. Aorta is on top of the ventricular septum and not the left ventricle. So let's visualize this. This is the heart of someone who is healthy. Now take note of the four chambers, the right atrium, the right ventricle, the left atrium, and the left ventricle. And see there's a septum that separates the left and right ventricle, and the pulmonary valve is wide open for blood to flow into the lungs. Okay, now if we look at the heart of someone who has Tetralogy of Fallot, note that there is a hole now in between the right and left ventricle. This allows the mixing of oxygenated and deoxygenated blood in a process called shunting. Also, the pulmonary valve is closed, or it's really hard for blood to get through. This is what causes the right ventricular wall to thicken because it has to work harder to pump blood into the pulmonary artery. Now, a thickening of the wall actually leaves less room for blood to fill into the right ventricle. Okay, so what are the symptoms of people who have this? First off, cyanosis or bluishing of the skin is when someone has an oxygen saturation below 70%. We also see shortness of breath, difficulty breathing, fainting, clubbing of fingers and toes, as well as a lack of weight gain or low birth weight. Okay, so next we're going to talk about how it's diagnosed. Generally, we can use chest x-rays to look at the structures of the heart. We can also use echocardiograms, MRIs, and pulse oximetry tests. But usually once a child's born, we can use that cyanosis to look at the skin and tell if they're blue and if they have a heart defect right away. Okay, so what are some of the risk factors that cause the disorder? First off, maternal alcoholism, diabetes in the mother, maternal age over 40, and also poor prenatal diet can also cause Tetralogy of Fallot. Some of the treatment options for these kids include surgery to correct the ventricular septal defect or the pulmonary valve, medications such as vasodilators, and then supportive care. So these kids can't always go to surgery right after they're born. They have to become strong enough, and supportive care are things that make it easier for them to breathe. We also need to note that there are these TET spells that they go into, which are an acute worsening of symptoms. We see that deep blue cyanotic skin, and they also may be squatting. So the reason kids squat is because it helps them breathe better. By squatting, they cut off that femoral artery, and there's more blood going to the chest cavity, and thus more blood going to the lungs. Okay, so now we're going to talk about the outlook. This is a lifelong condition that requires lifelong care to make sure structures don't get worse. It also requires regular visits with the cardiologist. There might be limits on strenuous activities such as sports and antibiotics to prevent endocarditis. All right, so that's all I have for today. Thanks for watching. Be sure to like, comment, and subscribe, and let me know if there's any other videos you guys would like to see in the future.